Nurses are key to the healthcare system, but the Canadian Nurses Association predicts that the shortage of nurses will increase fivefold between 2007 and 2022. Over the past few years, a large number of studies have looked at causes and potential solutions for the shortage. In October of 2008, Health Canada approved a proposal by the CFNU, the Canadian Federation of Nurses Unions, to implement pilot projects collectively known as Research to Action, Applied Workplace Solutions for Nurses. At the national level, the CFNU partnered with the Canadian Nurses Association, the Canadian Healthcare Association, and the Dietitians of Canada, all of whom helped to provide guidance and advice.
C'est très important pour notre fédération de faire des projets comme Recherche à l'action, car on représente les infirmières qui sont sur chaque unité dans nos communautés et qui travaillent tous les jours. Alors, de prendre l'évidence que nos chercheurs canadiens ont pu trouver et de le mettre en action, c'est ça que ce projet ici va donner, c'est ça que ce projet ici va donner en tant que succès dans la rétention et le recrutement de nos infirmières et infirmiers. We're empowering the workplace, we're empowering nurses to make changes, to be part of the decision-making process, and that hopefully will retain and recruit more nurses and to be able to provide better care to patients along the way.
The 10 pilot projects aim to improve workplaces and increase the retention and recruitment of nurses across the country. The projects reflect the specific needs of the various regions and were designed in collaboration with local employers, governments, and union partners. Skills upgrading is an important way to improve the quality of patient care, but also job satisfaction for nurses, especially when training is provided close to the workplace. In Prince Edward Island, there were no critical care or emergency nursing programs. Nurses traveled to Halifax for certification. Research to Action provided for nurse educators and coordinators to develop the knowledge and skills needed to deliver the programs within PEI.
So today we're at UPEI, we're in the simulation lab, and we are going to be running a simulation today with the students. We're running a cardiac arrest, a VFib arrest. We're using a simulator that was purchased through the Research to Action program. One of the benefits of having a simulation like this is that we have the students in a controlled environment.
12, 13, 14, 23.
It's a huge piece for PEI because when students have to leave the province, a lot of times they either A, are not engaged or they don't want to go to Halifax, or B, they may end up in Halifax and stay in Halifax.
Nunavut has only one hospital in the territory, with a unique staff blend of seasoned and young nurses. But as a small hospital, it's difficult for it to train, mentor, and assimilate new nurses into nursing practice.
The RTA project has enabled us to take our competent nurses and raise their level of skill to that of experts, and to take our novice nurses and raise their level of skill to competence.
There's a lot of skills involved in being a nurse, and especially when your patient is critically ill. I believe that the critical care training helped refresh our memory and teach us what is new and improved now. As a critical care champion during this project, I was also trained to be able to share this experience and share this knowledge with the people who weren't able to join. That way the knowledge is not kept to a certain group of people, but everybody can take advantage of all the knowledge that the project has given to us.
Healthy workplaces thrive when nurses are engaged in assessing patient acuity and changes in patient and staffing needs. At Hamilton Health Sciences, a web-based tool called the Nursing Dashboard consolidates a wide range of factors in a unit and acts as a starting point for discussion between managers and frontline staff.
Being a frontline nurse, working on a cardiology unit, I know what goes on as far as activity. I can tell you verbally what the day's like, but it's nice to see that there is a tool, electronic tool out there called the Nursing Dashboard, that accurately captures the activity of the unit. Nurses want to be involved. They want to collaborate with managers. They want to provide the best care possible to their patients, and this is our chance to collaborate with the managers and know exactly what is behind the staffing model that they use.
In Saskatchewan, the Synergy model is being adapted for use in a unit at St. Paul's Hospital that articulates patient and staffing needs. It will have a direct impact on improving patient care and measuring nurses' workloads.
Recruitment-wise, anything that forces you to take a look at your teamwork, advances the scope of practice and expands what you're doing, increases patient care, you get a reputation for having those things, and then your recruitment's done for you. You don't have to do anything because it's the culture of your unit that this is a place that I want to go and work because I've heard that Six Medicine has impeccable teamwork, they have great patient care, and I had a friend whose mother was there and she had the best hospital stay ever.
Despite growing demands for long-term care, it's difficult to retain and recruit nurses in this sector. There are fewer training opportunities and less support than in larger workplaces. Nurses are sometimes the only healthcare professional on at any one time for 50 or 60 residents. In Manitoba, the RTA project enhanced orientation for 12 nurses by supporting their participation in 6 clinical care workshops and matched less experienced nurses with mentors.
I would meet with my mentor if I had any issues, and she could help me with new skills that I hadn't experienced before. She would show me how to do those, and computer work, and also dealing with staffing issues per se, with healthcare aides or whatever. I could talk to her about anything I needed some advice on, and I really appreciated that.
New nurses often feel overwhelmed by the demands of the profession, the lack of professional development opportunities, and the difficulty transitioning into the workforce are major obstacles to the retention and recruitment of nurses. In Nova Scotia, the RTA project is supporting a mentorship program that matches new graduates with more experienced nurses.
I think that the establishment and the continuity of this program is essential to a new grad coming out of school and transitioning into that workplace. It's when you think about it, some of them are like, it's scary when you haven't met up with some of the situations that they're forced into, and if they've never had any experience, it can be pretty earth-shattering. And it's time that you can say, okay, let's have a little chat later on. I remember when that happened to me, and this is how we got through it.
To improve orientation for nurses in New Brunswick, the RTA project facilitated the delivery of a web-based orientation program for newly hired nurses.
Pour nous, en conception pédagogique, c'est de penser à qu'est-ce qui va être le meilleur moyen pour l'apprenant pour pouvoir comprendre cette matière-là si on ne la passe pas en texte, qu'on la passe soit sous forme de vidéo, d'animation, de petits questionnaires. Donc ça, c'était mon rôle pour moi, de travailler avec l'expert de contenu pour développer son contenu puis de trouver des moyens de le passer d'une façon la plus facile possible pour les différents types d'apprentissage pour le mettre en ligne.
La nouvelle génération comme moi, on cherche un endroit pour travailler qui utilise des choses comme ça, qui sont à la fine pointe de la technologie, qui sont d'avant-garde et tout ça. Donc moi, ça va me faire choisir un milieu plus qu'un autre si on utilise des outils qui sont actuels plutôt que des outils qui sont désuets. Et l'informatique, on tend de plus en plus vers ça. Donc c'est quelque chose qui facilite le travail, c'est quelque chose qui facilite notre vie.
In the 80-20 staffing model, nurses spend 80% of their time on patient care and 20% on professional development. The results have been proven to reduce sick leave, overtime, and staff turnover, while also improving job satisfaction. In Newfoundland, the RTA helped implement an 80-20 project with the intent to increase job satisfaction and develop a greater capacity for RN leadership in a long-term care facility.
I felt that the 80-20 project was a wonderful idea. I got a lot out of it. I think a lot of other nurses did. Very good experience. I've had done a lot of courses and a lot of conferences through this that would have never been made available to me. So it just makes you feel better about your career, and right, the fact that they're giving us time to study and help us out.
In British Columbia, nurses found the 80-20 project provided for professional development and also improved unit morale.
Just that with your increased knowledge, you have increased skill, and you just feel, I think, what I would say is just more passionate about when I'm coming into work. That you just feel surrounded with that knowledge, that confidence again, and just you feel more solid in your nursing again.
Something that made a difference for me in the 80-20 project is that I was able to enter into the BSN program. I am now at the end of second year thanks to the 80-20 project. I was able to maintain my position on 5 South and keep my mentors here on the floor with the educator, and my work life and student life was well balanced.
The Alberta RTA project was an evaluation of 7 retention and recruitment initiatives contained in the current Alberta Collective Agreement. These province-wide initiatives included the new Graduate Transition Recruitment Program, pre-retirement programs, and flexible work arrangements. To date, over 1,600 nurses have participated in the 7 initiatives.
It's done what I intended it to do, or what I had hoped it would do. It allows me to continue to work, and it allows me to be very involved with my children.
I love it. It's given me, I don't know, enthusiasm and keeping me happy. If it didn't exist, I'd probably be more tired, I think not as positive, and either perhaps retired or definitely reduced clinical or not working in an acute care situation.
So without the supernumerary program, I would have eventually at some point pursued a career in ICU. It would have probably been 5 or 6 years down the road before I felt competent enough to even consider applying.
They can only be positive. They may not appeal to everybody, but they will appeal to somebody. Somebody will think that's a good fit for their life. And if you can keep one more person from maybe leaving the profession because the fit's not right, it can only be positive.
A national steering committee helped oversee the implementation of the RTA project, with representatives from each pilot project, as well as from the CFNU and its national partners, the Canadian Nurses Association, the Canadian Healthcare Association, and the Dietitians of Canada.
The really value of this partnership is going to be for patients in our province, because we already have interest from what we learn in this project to be able to translate it to long-term care in our province.
Collaboration is essential. When you're discussing or trying to address workplace issues, concerns, whether it's recruitment and retention or anything, you have to have all of the right people at the table.
Everyone is reporting that it's a great model for the future, and there are going to be all kinds of serendipitous benefits from having established those relationships.
The RTA project engaged with nurses over 1,700 times, from surveys and workshops to training and professional development opportunities. It resulted in collaborative partnerships, improved workplace morale, increased skills and expertise, and sustainable programs with specific tools and resources. It also increased employers' capacity to engage in collaborative project development and research. The project will result in better retention and recruitment strategies for nurses well into the future.
Nurses want to be involved. They want to collaborate with managers. They want to provide the best care possible.
And you just feel, I think, what I would say is just more passionate about when I'm coming into work.
You get a reputation for having those things, and then your recruitment's done for you.
La nouvelle génération comme moi, on cherche un endroit pour travailler qui utilise des choses comme ça, qui sont à la fine pointe de la technologie.
I think that the establishment and the continuity of this program is essential